So tell me, get my voice. Who's listening? Very close to the Wi-Fi now. You've not logged in. Jennifer, have you logged in?
No, enjoy the so somebody
Very good.
this guy we need to send to the one is next to email after restriction. But I don't know how to not use that time. I think it's really, I mean, seriously.
Try and go off this network. Let's
But it looks really connected.
so hello.
Yes. Okay. Awesome.
Testing the mic. Are we good? So today is an interesting day, one of the best days. Anytime we get an opportunity to talk to you about what we do and how best we can help you, we are always super excited.
So that means my resource.
Now, powerful people we did this webinar. Powerful people. Testing. Good morning, everybody. Welcome to another exciting edition of our webinar. Today, we are going to be talking about knee pain and everything that concerns knee pain. And as usual, what we do in Amazing Physiotherapy is to help active people recover naturally so that they avoid relying on pain medications, injections, or have to do a surgery. So who are this webinar meant for? If you are unsure or skeptical about the cause of your knee pain, or you need a little bit of more information concerning how to go about this knee pain solution, then this webinar is for you. If you are also concerned about what you need to know, how to prevent it, what led to it in the first place, this webinar is also for you. The interesting thing is that this webinar is filled with like minds just like you, people who are struggling with issues and symptoms that have to do with their knee pain, difficulty going up and down the stairs. Sometimes when you sit down, standing up, you feel a lot of discomfort in your knee. Sometimes when you want to squat, or even just pick your kids, pick your grandkids, like our grandmothers who have come into our clinic and complain, or even sitting down is a problem, then this webinar is for you. What do you intend to get? We expect that before we leave this webinar, and also those people who are interested in making the right decision about what to do next and how to inform their decision-making process so that when they decide, they know that they are making a decision out of a place of knowledge, not just because everybody says. You know, it is pretty easy. Everywhere, lots of information. We are in a world where so much information is available to everybody at our beck and call. You can just pick up a phone and you can see everybody promise you solution to your problem. But what we are doing is we are trying to use this opportunity to share knowledge, to let people know what it is that they are going through, to see who is relatable to what it is that we are talking about. And if we are able to do that for you, and you understand, for you to understand exactly the root cause of your problem, then you ultimately will make a decision out of a place of knowledge. So today we are going to be talking about the general picture and overview of what the knee looks like, common causes of knee problems that we encounter in our day-to-day life, the mistakes people make when handling their pain, and exercises or interventions that are worthy to note, so that when you want to solve your knee problem, it will be easy right for you. And I want to promise you something. If you stay till the end of this webinar, I will assure you of a free gift. So sit tight, listen attentively while we get to the end of the webinar. And interesting questions too will also follow suit. Yes, so just like I said, we are an active group of people, likable, loving clinic. And one of our vision is to make sure that we reduce the burden of problems that people experience with work-related discomfort. Discomfort such as knee pain, which we're going to talk about. We also talked about neck pain in the past episode, low back pain and shoulder pain. So these things go on with people for countless years. I wouldn't tell you how many people who walk in and into our space, and they will always tell us, I've been having knee pain. How long has it been going on? It will be interesting to know that some people have lived with this pain for more than 5, 10 years, 15 years. And it's also worthy to note that the earlier you solve these problems, the better for you, and the better for your pocket, and the better for your productivity. Because there is a link between pain, happiness, and productivity. So if you are happy, you are able to be more productive. If you are living a pain-free life, you are going to be likely to be a happier person. So introducing Amazing Physiotherapy, who are we and what do we do? We have been in existence, the sole purpose of helping our community live pain-free. And what we do is we help people live their life to the fullest. So they live their life without bothering about when the next pain will come. And you can see we are interested.
Then I don't have bringing more stuff.
Shows on the slide, you can see across Nigeria where we have our clinics. And a community has received us really well. And sometimes,
yes, one of the ones
in the past, someone joked and told me,
the one I dropped yesterday,
I have no fear of having pain again, because when I have pain, I know where to.
I'm here to collect my things.
Our engagement, and that's also part of
I was
our
here yesterday.
to make sure that access to treatment.
From where?
Treatments that
How long will it take?
Evidence-based treatment is always accessible for people in pain, and they can solve their problem all the time.
So
and again, just to share a bit of our achievements. In June,
I brought it yesterday. How will it be ready? The two that I did fitting for yesterday.
Physiotherapy service provider of the year. And the interesting thing is that we made sure that the award went around all our clinics. So in all our about 9 locations, you could see everybody smiling at the camera, posing with the picture, because we only got this far because of the reviews, the feedback, and the trust and the engagements that the patients have given it to us. And it feels so good to us when you entrust your health to us, and we will never let you down. So understanding the knee joint. The knee joint is a very complex joint, and it is encapsulated within 4 bones. Now, don't mind a lot of the fancy words that we're going to be using today, but just pick a note and take a few points. So we have the femur, which is a large bone. Then we have a tibia, which is the second bone. We have a patella. The patella is an interesting bone that forms only after 2 years of life. So when I had my first daughter, I went and I was expecting, because I know when to feel for her patella. So each time I go to her and I'm like, honey, can I feel your knee? Is your patella coming out? And voila, when she was 2, I saw it. So in the second year of life, we begin to develop our patella. But of course, the femur and the tibia had already formed. And they are all encapsulated within a joint capsule. And within a joint capsule, this provides that level of stability that we all need to do. Now, there is another thing you need to know about the knee joint. Knee joint is what we refer to as bicondylar. What it means, don't mind the fancy word yet again. It means that it moves only in 2 directions. It moves in flexion and it moves in extension. So flexion is this, extension is this. So when that happens, that allows us to go up and down the stairs. It allows us to sit. So imagine when you want to sit, you are sitting with flexion. When you want to stand, you are standing with extension. When you want to go up the stairs, your first step, you flex your hip, you flex your knee, then you go on the first flight, then you extend your knee so that you can also complete the cycle with the second slide. So the knee complex is very interesting. And I will also want to, elaborate more by showing us what the knee looks like with this. So don't mind this, I call him Mr. Silvanus. Mr. Silvanus was our patient. So when he came, we treated him for knee pain that he never expected we were going to solve. So when he finished, he recovered, he donated his knee to us. So this is Mr. Silvanus' knee, but I'm going to use it for the purpose of today's presentation. So this is the femur that I was talking about, and the femur has a concave end. This is the tibia, the convex end. This is the tibia, and it has a concave end. And you can see the tibia. And this is the fibula. The fibula does not actively engage within the movement in the joint, but it is important. A lot of us live our lives without the fibula. But what the fibula does is it provides room for attachment for a lot of muscles that aid our knee movement, stability, and mobility. So you see, God in his infinite mercy made sure that he created us, and every part of our body is useful and it's ready to perform a particular function or the other. Isn't that interesting? So there are lots of interconnectivity going on within the knee. And I want to also talk about something really very interesting. something a lot of us neglect. And when it begins to have issues, we tend to hear things like you need to get a knee replacement, you need to have numerous injections in your knee, even though we don't advise that, because there are so many researches that have come out in recent time to say that people who have multiple cortisone injections in their knee end up with degenerated articular surfaces. And once that happens, you are going to lose lots of integrity in the bone, you're going to lose the density in the bone, and you will be susceptible to fracture, osteoporosis, and even the pain will not go. And at the end of the day, you will come down with so many other medical conditions that you never anticipated. For example, when your knee hurts so much, you don't move so much, and when you don't move so much, chances of high blood pressure begins to come in, obesity begins to come in, diabetes begins to kick in. So everything is connected, and that is why we are spending so much time to explain exactly what it is we need to understand within our knee. Now we have the meniscus. The meniscus is what I would describe as a triangular lamellar kind of objects. What does it do? It helps in distribution of force within the knee joint. And there are two meniscus. You have the lateral one and the medial one. It is shaped like a crescent. So a crescent is something that looks like a banana. But one thing with the meniscus is not every part of it is vascularized. In fact, it is up to 2 years. There is something very spectacular about 2 years with the knee. Imagine in 2 years, the patella begins to form. In 2 years of life, that is the last time you have full blood supply to the meniscus. So after 2 years, the red zone moves a little bit outwardly. Then the internal one do not have so much of a blood supply. So what it then means is when you have direct injury within your meniscus, it will be very difficult for you to heal. But thank God, we have lots of amazing researches and interventions that can also help you live a well-fulfilled life, even if that happens. So within that meniscus, it creates that shock absorption for the knee joint. Because, you know, some of us must have gone to see the surgeons or the doctors who say we have our bones on bone. When that's happening, that means all the outer, the internal, the posterior and the anterior horns of your meniscus have degenerated so badly that you need to see a specialist who can intervene as fast, because the bone ends, the concave end, the convex end of the femur and the concave end of the tibia now begin to interact. And you know, the meniscus do not have vascularity and sensitivity at the ends of the bone. So when it eats off, the crushing effect, the joining together of this upper layer and this lower layer gives you that excruciating pain that at the end of the day, the doctors or the surgeons may not have option than a knee replacement, an arthroscopic capsular release, so many other things that you may expect that has happened from an intervention, something you probably would have prevented earlier on. So there are two large groups of muscles in the knee, right? We have the extensors and the flexors, and we also have the ones that help with internal rotation. So the big muscle that you find, we call it lats. When I play football, we always want to do a competition of who has the bigger lats. So the lats is the big muscle we call the quadriceps femoris. Now, there is another one where we call umpata. That is at the back, hamstring. The hamstring is the one that also controls some level of flexion within your knee. You also have long ones that move all the way from your waist to the lower part of your knee. I'm also going to talk about the interconnectivity between different joints in the body, what we refer to as complex interregional dependence. It's also a fancy word, but what it means is sometimes you may have a problem in one area. You may be feeling pain in a particular area. You would think that is where the problem is coming from. But usually, it may be coming from somewhere else. That is why we also want to share this information so that we can know what to expect and how to go about solving our problems. So you also have some other smaller muscles that support the structure of the knee. The overall responsibility of all what they are doing is to provide stability, provide better mobility, and to provide maneuverability for you, depending on the kind of work you do and depending on the activities you are engaged in. Now, another interesting part again is, what are the primary stabilizers of the knee? We have the ligaments. The ligaments too are taut band connective tissues that have fibers that run from one connecting part of the knee to the other. For example, you have the medial collateral ligament. A lot of us must have heard that connects from the epicondyle of the medial part of the femur down to the tibia. But I want to hammer on a particular ligament that the injury is so popular. You know, growing up, when I want to play football, my mom will say, "This boy, you don't want to be useful in life, right? Stop playing football." And I was talented with football. What is paining me is that I see my mates earning money in football, but I can't. But these days, parents have come up to agree that the kids should play football. So I feel like wanting to be young again so that I can become a superstar. Maybe I will have, if I'm a footballer, I will have likely been a goalkeeper. So, but that's aside. Now, you will find out that your kids will be complaining so much about knee pain. They will tell you that they suffered a tackle and their knee is injured. Most of the time, that injury might be coming from what we refer to as ACL. I want us to listen attentively. If your child injures his knee from playing football, the solution is, "Junior, I have warned you." The solution is not, "Junior, I have warned you, don't play football again." It is, "Okay, relax, relax." Because the injury your son is having is the injury professional footballers people have. So take care of him, nurture him, get him to see the best available people to treat his problem, because he's probably doing so much. So, but that's it. It's for us to know that this ligament is likely one of those ligaments that will end up getting injured with certain movements. So there are a host of other things like the cushioning effect that is being created by a thick fluid. You know, everything around the knee was just wonderfully and beautifully made so that we can enjoy life as human beings. So understanding the knee joint continues. When you have meniscal ACL tear, what should be the recurrent questions that we always get is, what should be the first thing I do? I always advise them, get proper assessment, depending on the age of the person, right? We always advise that if the younger folks, kids who are within the early phases of their life and their career, should get a repair done. Usually, the two bands may not have ruptured completely because there are different grades to how these injuries occur. So sometimes if it's the grade 1, which is just a stretch, you don't need any repair. But sometimes you get to grade 4, where you will have total transection of the fibers of the ligament, especially the ACL. You need to repair it. Then after the repair, the quadricep, which is the bigger muscles in the front, need to be worked on, and also the muscles around your glutes that will enable you to propel better and come out better after you recover from your injuries. So common surgeries that can happen with that are ACL repairs, arthroscopic surgeries. Then with advanced cases of total erosion of the articular joint surface, total eradication of all the tissue, the surfaces, and the person is in so much pain, we usually will advise to go for knee replacement. But now, we are not trying to get you to do the surgery first. We want you to know a little bit more about your knee so that you can prevent the surgery. Just like what we said, we want you to live an active life. We want you to live a pain-free life so that you avoid relying on pain medications, injections, or have to do a surgery. So isn't that very interesting? That this thing that we are so much afraid of can be prevented by just getting to know about it a little bit. So how did we get to specialize in the knee? Just like I said, I used to play football when I was very young. And I found myself studying physiotherapy in the University of Nigeria, graduated 2-2. I took 2, I gave the university 2. So everybody is happy. Then I did my master's in Kano. Then something really struck me, how lots of young boys who are trying to build up their career in sports, a little injury in the knee, they end up. The one that traumatized me so much was a young boy who we all knew had a very bright career in football. One day he was just playing football and the back of a leg of a defender connected with his knee. And voila, I didn't even know what it was called then because my specialization was not knee then, but I took a particular interest to see how I can solve that young man's problem. And by and large, we started work. I started researching a little bit about it. I took extra courses in knee rehabilitation. And by the grace of God, I wouldn't mention his name. He's playing in Israel. He's playing in the football field, in the football team in Israel. He's doing well. But the only thing is that he's not sending me dollars. So, but I forgive him. I make sure that I impacted in his life and he's successful wherever he is. Now, we came up with a strategy that we are going to eradicate knee problems within the confines of amazing physiotherapy. Then we had an extensive training. Part of what we do in our clinic is to make sure that all our doctors are well versed in the management and rehabilitation of knee injuries. So when you walk into our clinic, 2 out of 3 people who come in, maybe low back pain, neck pain, you will have knee pain. And people who come down with knee pain always go home happier than when they came in. So when people walking into our clinic, what is the typical assessment like? So we want to know what has been going on with you in the past 30 days. We'll ask simple questions like, are you having issues with standing? Are you having issues with walking? Are you having issues with squatting? The interesting part is squatting. And I always get that from our female patients. They always tell you that, you see, Dr. Nnamdi, I am really struggling with knee pain. They will not even call it knee pain. They will tell you, Dr. Nnamdi, I find it difficult to squat. You know, just like I said, when people come in, it is the areas that is of disturbance to them that really matters. They will tell you I have difficulty with squatting. Then we are now looking at the check. Okay, could it be coming from the back? But 95% of the time, when you hear I have difficulty with squatting, you know it's the knee. The reason is there are external and internal problems. The external problem will just be the anatomy, but the internal problem is what is stopping the person from doing. It could be that the person loves to squat, the person loves to dance. So these are some of the things we like to ask. Then we also want to ask questions with standing. When you stand for too long, how do you feel? Does your knee hurt more? Do you struggle standing to keep up at that space? Then when you run, what happens? So there's something again I want us to understand. The impact with the work of the meniscus. Now, just like I said, they work with distribution of forces and a shock absorption. In a typical human being, when you are standing, right, and when you are walking, all depends, there are impact levels and how it's been felt within your meniscus and the distribution of forces within your knee. When you are walking, there is an increase of about 1.2% increase in the weight and pressure in your meniscus. When you start running, it increases to about 3.4. So we want to ask those questions because if you stand and you feel a lot of pain within your knee, then we know that walking is going to be difficult. Running is going to be a no-go area. And part of the things and our obligations to you is to get you to your maximum level of performance as a human being. Nobody is confined to just sit. So you wouldn't be expecting that you go meet your doctor and you complain about not being able to walk. And he says, sit down in one place for 1 month, don't walk if you go. When you walk in, you are expected to know the level at which you are at, what next we need to do, and how to build you to a level greater than what you even anticipated in the first place. So that makes it a lot interesting. So within the last 30 days, we want to know when and when were your good days, when and when were your bad days. If we are able to decipher that and walk through all that, then it will be a lot easier for us to let you know what it is that is likely wrong with you and how to go about solving the problem. So, every human being is alike. I love to say that a lot. We are all alike. We reason alike. We are all emotional beings, and we think we are logical. But the truth is that we are very emotional in so many ways in how we handle our issues. Now, what are the 3 common mistakes people make when they want to handle pain? First of all, you have a lot of people, when they have pain, they will tell you, you know what, my grandmother has this pain, she's been having knee pain for too long, so I think it's just a family problem. I will just ignore it. I may be lucky, it will go. They will just ignore it, right? These are some of the common ways people do it. Sounds like an excuse. So they make it look like it will go on its own. Just like the clients that we've seen in our clinics. Truthfully, some people have tried something in the past, and maybe one of the challenges they had was who could solve their problem the way they wanted. So they usually do not get that level of salvation or succor as they anticipated. So it takes longer. But majority of them will tell you that they've been living with knee pain for 6 years, 4 years, 2 years. Since we are not really very upfront with prevention of injuries or early intervention, but it's normal. But the good thing is that there is a solution at whatever point you come in. But there is big solution and there is small solution. Big solution on the extreme may be a surgery, which you may not like, or early intervention that the simple home exercise can even help you solve your problem. So the second thing that they do is they may want to alter it. So how do you alter your pain? You take painkillers. I asked one of my female clients who walked in, I said, what have you been doing? She said she's been taking painkillers, then sometimes she will do hot pack, cold pack, that she's been doing like that. I said, okay, this painkiller, why did you stop? She said she started developing ulcer. So when she went back to the doctor said, okay, she needs to stop painkiller. Now, what next can you do? Okay, I don't know, maybe you have to live with it since it's part of your family line. But we want to say something differently can happen. And if things can happen differently, we want to start with you understanding that things can be different. When you understand that things can be different, solution to your problem becomes its own truth. So the next thing a lot of people do is they handle the pain. So handling the pain means they now pull the bull by the horn and say, you know what? I am going to look for a knee specialist. I'm going to look for somebody who can solve my problem once and for all. And solving my problem means I'm going to look for a dedicated person who has put in a lot of years and study in solving the problem that has to do with the knee. And they end up tackling the problem head on. So it is normal for us as human beings to procrastinate when handling our issues. But one of the things that happen is, if you procrastinate, for how long will that continue to be? You will always be in penury. You will always struggle because you do not live a fulfilling life as you want. And when they say, oh, it's time for us to go somewhere, you will always find an excuse and say, oh, I cannot do it because I have pain. And when they say it is time for us to dance, oh, I can't dance, I have pain. And when you go and it's time to pray, oh, I cannot pray because I have pain. So some of all these things are some of the things that happen when you either ignore or alter your symptoms. But today, we are going to get to the root cause of your problem and make it easy for you to solve your problems. So most common knee pains, you see, that's very interesting. Now, sprain is common. And when we talk about sprain, it is either you are spraining your ligaments or straining your muscles. There are a whole myriad of different causes of knee pain. So sometimes I wonder, when people walking into the office, they ask me if they should get an x-ray. Sometimes I say, you see, X-rays will not determine causes of your knee pain beyond just looking at the bones. And it is most likely that if you don't have a fracture or you don't have a bone spur, there is likely nothing an X-ray will have done for you. So people come down with strains, injury on the ligament that I talked about. The common one is the ACL tear. We also have the medial part of the ligament being torn. There are a whole lot of things that can happen. Now with muscle tear, it happens. The big part of the muscle, which is in the front, which we refer to as the quadricep, you could have contusion there, right? One that happens with a lot of our tall kids. It's also there. There are some genetic things that happen within the knee. So with the sprain of the ligaments, for us to understand, these are taut bands, and at certain points, their responsibility is to provide stability. So at certain movements, they are less stronger, and at certain movements, they are stronger. For example, now the function of the ACL is to prevent anterior, like forward translation, so that your knee doesn't push out all of a sudden. But when your knee is flexed, it becomes more vulnerable. So different movements determine the kind of pain or the injury you may likely have. So when we are intervening, we want to train those vulnerabilities so that even if you are vulnerable, the chances of sustaining an injury is reduced because you are prepared. Let me give you an example of preparing you in case of eventualities. Athletes will always come down with hamstring strain when they don't stretch their hamstring enough. How does hamstring come about? Overstretching, you see? But we also use that stretching to prevent the hamstring from coming. Everything has to be graded. When it's graded, it's easier for you to solve your problems. So we move on to the next most common cause of knee pain. Now, the most common knee pain may be meniscus injury, like I talked about. The meniscus aids in the distribution of forces within the knee joint. We have the medial one, the one that is internal. This is the medial part of our knee, and this is the lateral part of our knee. We have the medial meniscus, which is crescent, which appears in a crescent, and the lateral one, which appears more like in a circle. Now, their functions may be impaired with so many things like injuries. Sometimes you may be involved in a road traffic accident, but nothing happened to you. Sometimes you fell into a gutter, but nothing happened to you. Even with age, it begins to degrade. So degradation of the meniscus exposes the articular surfaces of your joints. And when that happens, the bones may likely begin to come in contact with each other in what we refer to as reduction of joint space. And when that happens, irritation of the nerve endings begin to happen. You see, that is what happened. Isn't that beautiful? But it can always be prevented by working on all the structures, making sure that they are always ready in case of eventuality, so that when it comes, you will be spared. So arthritis. You see, everybody that gets an X-ray for a knee in my clinic comes down with arthritis. It is either early arthritis, middle arthritis, or late arthritis. But we can understand that there are several reasons why knee pain can happen. And when it comes with arthritis, this is a normal aging process. A lot of us will come down with arthritis, whether we like it or not. There is no amount of prayer that will stop us from getting degenerative changes. It is part of aging. In fact, it is God's will for us, so that we can, when I'm old, I can tell people I'm 95, I have arthritis. Show me your own arthritis. Yes, I'm old. It's God's doing. So if you want to get old, be ready for arthritis. It is normal. It is something that you are going to experience, and there are no two ways about it. But so the problem now is, when does arthritis start to hurt? This is it now. Lifestyle problems, posture problems, the kind of activities you are involved in, how physically active are you? Because if you just have arthritis and a little bit of muscle imbalance kicks in, there will be a lot of pain. And usually, People end up just wanting to solve the arthritis problem by just shaving out the muscle, the bone end and replacing it in total knee replacement and hip replacement. Well, to a large extent, a lot of people would benefit from that. It will improve their quality of life, but so many other people will still suffer because the muscle imbalance wasn't taken care of. Maybe the pain wasn't even in their knee in the first place. It may be somewhere else. I will also tell you a story, a conversation I was having with a client that brought her mom for an assessment. She had knee pain and she had back pain. The question was, which one is actually causing the problem? So I had a conversation with the surgeon, and the surgeon suggested that she does back surgery before knee surgery. But because I am in a profession that loves to prevent people from relying on painkillers, loves to prevent people from going for surgery. I looked at her and I looked at her knee. I said, because she was complaining of back pain, I said, your back pain is caused by your knee. Now, because we have looked at your knee extensively, and we can see that there is little or nothing conservative treatment like what we do in our office can do for your knee, I advise you do a knee replacement. Then after your knee replacement, we can then start thinking about the solution for your back. Behold, she did a knee replacement, both knees, the back pain has disappeared. Why was she having back pain? Remember the imbalance we talked about. Now the imbalance with her walking was affecting the biomechanics in her back, and the structures in her back were becoming tight, painful, and irritated, and she began to have pain. So imagine if she had gone to do back surgery. She would have just done 2 surgeries. One was necessary and one was not necessary. So that is why it's important for us to look at all these things and know where and how to solve our problems. Yes, so we go. So most common causes of knee pain. So it's important for us to know that it is not only the structures or the joints that are involved that usually come down with the knee pain. Like I cited earlier, what I refer to as inter-regional interdependence. Complex regions in the body affect or determine how other areas perform or are being felt. So if you have injury somewhere, you are likely going to feel the symptoms somewhere else. For example, a very popular one that we also see in our clinic, back pain. Sometimes we will say, doctor, I feel this terrible sharp pain going down my legs. I feel numbness. I think I have a problem with my legs. Please do something about my leg. When we look critically again, it is from the back. It's also for the knee. When your knee has an issue, remember, a lot of the muscles that actually work in protection and keeping the knee stable are from the back, from the pelvis, from the hip. So looking at all these areas and making them work and looking at them and ensuring that they are all functioning well will go a long way to solve half of your problems. So understanding where they are coming from, and it is within our territory to do that, and understanding how to solve the problem goes a long way to get you to the solution. So what does successful treatment for knee pain look like? Now, within what we do within our clinic is, first thing, you need to know what the cause of your problem is. The cause of your problem might be osteoarthritis. The cause of your problem might be arthritis. There are 2 types of arthritis, very common types of arthritis that we see. Sometimes you get to see gout from time to time. And you have osteoarthritis, which is the one that is as a result of the degenerative changes that comes with aging, or maybe a traumatic episode that you experienced in the past, or previous injuries that you have sustained within the knee, or erosion of the meniscus, or a genetic problem, right? Then we have rheumatoid arthritis. Rheumatoid arthritis itself is an autoimmune disorder whereby the body is fighting itself. And when the body is fighting itself, it struggles, and it doesn't only just affect the knee joint. it affects so many other places in the body. They might begin to tell you, oh, I'm having issues with my skin coloration and so many of all those things that might happen. So within these two areas that we see, one of the things that we always want to do is, let's be sure first. Like with rheumatoid arthritis, we want to send you for some investigations just to be sure if you have rheumatoid arthritis. But with osteoarthritis, pretty easy to determine. When you look at the X-ray, on one side, you correlate the history and the episode, you correlate the limitation, then you come up with a diagnosis. Then we pride ourselves as people who will always love to lay our hands on you and feel your pain so that we know exactly where your symptoms are emanating from. So hands-on PT is a technique that we have taught across all our clinics to ensure that people who have injuries are receiving the best intervention. And the second thing that will happen is strengthening and stretching exercises. A lot of people, just like I said, there is information. We are in the age of information overload. A lot of people have access to pretty much any information that they want. But the problem is, how do we differentiate the good information from garbage? Because a lot of them are garbage. So that is where we come in now. Nothing stops me from saying, go and watch exercises on YouTube or Vimeo or Facebook. But are those exercises right for you? That is another very important question. And just like what we do, we encourage people to be physically active. Like in the last World Physiotherapy program that we organized in Abuja, the message was also management of arthritis with emphasis on axial spondyloarthropathy. That's a fancy word. Don't think about it too much. What it's just trying to say is talking about different forms of arthritis and how movement and how we can be physically, a lot more physically active to prevent some of all these things that may be happening. So weight control. Imagine walking into a clinic and you have a conversation, you see your dietitian and she's telling you how to lose weight and she's overweight. Will you take the advice? No. So imagine wanting to solve knee arthritis problem and you are overweight. It can't work. They all go hand in hand. The same way you will not agree to a dietitian that is overweight to give you weight loss program. Because if she can give you weight loss problem, she should be able to solve her problem. But if she's not able to solve her problem, you wouldn't take her serious. So your knee will also not take you serious if you don't lose weight. And weight loss is a combination of not just exercise. I would like to put it as a weight loss is a combination of 30% exercise and 70% diet. The more you watch what you eat, the better for you. We are in the age of non-communicable diseases, lifestyle disorder, civilization, age of civilization disease. The more bigger I am as a big man, the more I'm able to booger, the more likely you are going to have disease. Except you start watching what you eat. They say the way to a man's heart is through his mouth and stomach. So your stomach puts you in trouble when you don't moderate what you eat. So as much as possible, I love to encourage my clients, perform your exercises regularly, take walks, take brisk walking up to 5 to 6 times every day, as much as you can. If your office has a car park, don't be the first person that will park close to the office door. Try to park a little bit far from the office gate door so that you can walk. If your office has a lift, why not say, I will not be using my lift? Use your staircase. That's also going to be a form of physical exercise for you. And when you do that and it becomes part of you, a lot of changes will come. And it's also interesting to note that some of all these changes that are being caused by lifestyle problems, the transformation doesn't just happen in a second. I've met a lot of people that go to the gym and after 2 months, they give up. They say that they are not losing weight. But the truth is that some of all these things take time. On average, it takes you about 6 months before you see a significant change in anything you are doing. We are not saying you cannot lose weight with very intensive programs, like a friend of mine that does keto, lost so much weight, and we're all thinking he was sick. But the bad side of it is when you stop doing keto, which is a very laborious act of losing weight that a lot of people struggle to keep up with, to gain your weight back. But imagine if you use a natural, sequential, systematic approach that guarantees incremental changes from time to time. Voila! Within a very short time, you will have your result. And the good thing is, it becomes part of you. So you have to note that. Sleep. I love to sleep so much. In fact, there was a day that I slept so much that they thought they needed to take me to the hospital. I love to sleep. And sleeping helps your joints. This is what sleep does. When you sleep, it reduces cortisol in your system and increases feel-good hormones in your system. And your brain gets an opportunity to also rest. And your joints will limit the number of the impacts, the heat, and unwarranted activities that they may be engaged in. And that saves you a lot. So we don't want to talk so much about sleep because in our subsequent webinars, we may want to discuss sleep extensively for a lot of people who have sleep disorders and how it's been affecting their life. Now, functional training. We've got the opportunity to have trained lots of athletes, professional footballers. Recently, we were working with a Super Eagles player who plays football in Europe, and some of the things that bother them, like the way we structure our program is, if you come into our clinic limping, we want you to go home running. So functional training is at the core of what we do. It is not only about solving your problem within just the limited time, but how do we solve it so that you can go back to living your life and even playing more football and even becoming a lot more stronger. So that is the idea, and that is the concept behind what we do in our clinic. So we'd like to talk about what you can do next. If you are attending this webinar for the first time, or this is the first time you are hearing about us, we want to, just like I promised, we are giving us assessments, free assessment for anybody who is interested in solving their knee problems. What you can do is you can go to www.amazingphysioclinic.com, search for the location closest to you. I promise you they will take care of you. If anybody argues with you, tell them Dr. Nnamdi sent you. I will plead with my manager for the benefit of those people that stayed in this webinar and have listened. They should get a free assessment, and at least they should go home being rest assured that their problem can be solved. Then any other thing that follows, any recommendation that follows, and I'm sure that can be up to you to solve. So it is www.amazingphysioclinic.com. You will see lots of beautiful faces there, lot of beautiful people in our clinics that will make it easy for you to solve your problem. So there are a couple of exercises that we often recommend. Just like we said, it's not about recommending exercises, but which exercise is right for you. A lot of people may benefit from walking on the treadmill. Others may benefit from elliptical trainer. Some people may benefit from recumbent bicycle. Others may benefit from static standing bicycle. A lot of all these intellectual maneuvers usually come in depending on your presentation. So it will be very difficult to take a decision about which one works for you if you do not present for us to diagnose and know exactly where to solve your problem. So I'm going to be demonstrating a few exercises that you can take home just as part of the support. And they are a bit generic, but as much as possible, I want to let us know a few of the do's and the don'ts when you are performing these exercises. And by and large, the last thing is it doesn't injure, it doesn't hurt. It's likely going to help you because the emphasis is going to be about how it's able to, whether you are doing what you are supposed to do well enough or not. So the first exercise we are going to be talking about is the mobility exercises. And the second exercise we're going to be talking about are the strength training exercises. The third exercise, the strength and stretching exercises. The third exercises are the motor control exercises. These are exercises that gives you the level of awareness that incorporates the function of the brain, balance, and the feedback your leg gets to show what and where you are in space and time. So now, there are lots of evidence-based researches that have come up. When I mean evidence-based, what I mean is these are researches that have gone through rigorous imputation, collection of data collection, rigorous analysis to say that a lot of time people focus so much in training their muscles of the front part of their legs and forget about other parts of the legs. So now there are three groups of muscles that we would love you to train when we want to demonstrate exercises for you. So some of all these things are not seen on YouTube, but it will be important for you to note them so that when the right time comes or whenever you are performing an exercise, it will be easy for you to solve your problem. So I'm going to get a model that will help us with the demonstration of these exercises. So please, can you come closer? Yes. So good morning, sir. How are you doing? Are you excited to be a model?
Yes, very well.
Okay, so thank you very much. So let me just take this out a bit so that we can. Now, when it comes to mobility exercises, the exercises of choice may be walking. Walking exercises are important. So walking. So walking, running, jogging, but you know, as we talked about what kind of exercises should you do and which you should not do, we laid emphasis on the level of pressure that may be on the knee joints will also determine which exercise that you would likely be benefiting from. Because we say that an extra 1.2% of the weight is being placed on the meniscus, the injured meniscus if you are walking, and about 3.4 extra weight is being placed on the meniscus if you are running. So mobility exercises are important, but I would like you to lay special emphasis on three groups of muscles. The first is the glutes. The glute muscles are the muscles around this area, your bum area. The second are the hamstrings, right? The hamstrings are the back of your leg. The third are the quadriceps. The quadriceps are also at the back, in the front of your leg. Then this place we call yam leg. So can you lie down so that you can demonstrate some of these exercises? Yeah. So lie down. Good. So you can see me. So now this is the yam leg. Good. So with the yam leg, you need to walk on the yam leg. And walking on the yam leg, the hamstrings, the quadriceps in front, and the glutes all go hand in hand to ensure that your knees are functioning and happy with you. So, one exercise that we often are encouraging people to do is swimming. So, with swimming, you utilize the impact of the hydrostatic pressure, the buoyancy, and the weightlessness. It is a common and often recommended exercise for people who will always complain about not being able to perform certain exercises because of the way their bodies are. So good. So now with swimming, you will be able to reduce so many things that will be of much impact or much pressure around your joints. And when that happens, it's easier for you to navigate and move. So movement becomes a lot easier. Recovery becomes faster because there is less pressure and you're not going to be in so much pain when performing some of these exercises. So now I want to talk about a few exercises that you can also do yourself at home, which is the knee extension exercise. But when you are performing the stop. So when you are performing the knee extension exercise, this, as we talked about earlier, is flexion. This is extension, right? Good. Now we want to perform knee extension exercises. And in performing knee extension exercises, the focus usually is the front of the leg. But it is important to also incorporate the glutes when you are performing knee extension exercises. So it is an exercise that if you are performing, you also need to do a lot for your glutes. Because if you are not able to train your glutes to actually liberate or to actually ease up so much pressure within your joints, no matter the kind of training or strength that you get on this area and this area, your knee will still hurt. So your glutes are very important. It's been reported in a lot of scientific journals and documents or documents and research that shows that working on your glutes alongside your quadriceps and your hamstrings will go a long way in solving the majority of your problems within your knee. So I want you to sit up so that we can show them what knee extension exercises will look like. So you sit up this way, then you bring your legs up. Very good. Then you bring it down. So these are common knee extension exercises that can help. So you bring it up again, then you bring it down. You bring it up again, then you bring it down. You bring it up again, then you bring it down. You bring it up again, then you bring it down. So these are common knee extension exercises. So another exercise that can also help will be the quad set, also working on the muscles here. So you can sit up this way. Now with the quad set, so you sit up. With the quad sets, we always want to encourage the client to get like a soft pillow and place at the back of his knee. So once he apply pressure on my hand, very good. You could see contraction of the muscle around this area, right? So now with contraction of the muscles around this area, it becomes a lot easier to train the muscles here. And when you train the muscle here, remember also lay emphasis around this so that you don't get this left out. Because most times people get to leave out the muscles here. So I'm going to show you an exercise that works out the muscle around this area, around your glutes. And working around your glutes will go a long way in solving your problem. So I want you to like with me, like at the side. I'm going to demonstrate a very interesting exercise we call the clamshells. So the clamshells can be done either with a band, a form of resistance, or without a band. So when it's done without a band, it's just a question of opening your legs, open and close, open and close, open and close, very good. So now you'll be working on your glutes, a very good way of engaging your glutes. And when that happens, it's going to help in collaboration with your hamstrings, in collaboration with your quadriceps to solve your problem. Now, another thing I want to engage, let you know, is stretching. When is stretching good? It's also important to note that whenever you are performing any exercise and your pain is increasing, I want you to back up a little bit, rest. Don't push yourself too hard, because pushing yourself too hard will only make the pain worse. And Incremental exercise have shown to give better results, better rest of mind than exercises that will just push through without going gently. So another thing I want you to go about life is down. When you want to stretch, so gently, a lot of people experience difficulty with moving their knee up to this. When clients walking into my clinic, I always tell them that the goal will be to improve the mobility in your joint. Like this young man has a very stiff joint. So if he complains about knee osteoarthritis or any injury that has to do with the knee, the first thing I want to achieve is full mobility and range of motion. And I always need to give my patients an idea of, imagine that we're going to be working on getting your heel to touch your buttocks. That is the goal, right? And most times with that, they are always motivated to want to do so much so that they can get that to work. And once that works, solving their knee problem becomes almost 80% gone. Now the mobility taken care of, we would like you to stretch. So one thing you can do is to get a towel and strap, or on your own. Can you try to get this to touch your buttocks? On your own. Very good. 1, 2, 3, 4, 5. So relax. What I like this exercise is also activating the glutes. So usually anything you're doing, you should activate the glutes more often than not. Because if you don't activate your glutes, you are going to not get the result that you are looking for, right? So another exercise that will be interesting to note will be stretching the back of your legs. So I want you to come face down. Yeah, face up, sorry. Very good. So in stretching the legs, this is what you might want to do. So you can flex this one, then bring this one up. Good. Take it up. Very good. So in performing this exercise, one thing you can do is you can get a towel and place the towel . Beautiful. Good. So let's assume this is the towel, but this is not the towel. Good. Let's assume this is the towel. Then you place it here, then you hold. Very good. So you stretch. Good. So you stretch a little bit. Very good. You count 10 seconds. 1, 2, 3, 4, 5. Relax. Let's say 10 seconds. But we can engage with even 2 seconds, 3 seconds, 4 seconds. The agreement is you are not pushing yourself too much. Because if you push yourself too much, you may end up giving yourself so much pain. And we don't want that. Right? We want you to always smile when this is happening. Now, if you note, he also flexed this knee. If I put this knee in extension, there will be a lot of more work for him to do. So you can start with bending this. Then gradually, as you keep improving and improving the flexibility around the back of your knee, you begin to drop this leg down. So another exercise, that's good. Another exercise that will also work your glutes and also work the back of your knee will be bridges. Very important. Because just like I said, you don't want to neglect the glutes. So raise your glutes up. No, raise your bum bum up. Very good. Then squeeze your bum bum. Good. 1, 2, 10 seconds. Usually, I don't like people to do more than 10 seconds because there is something good about 10. Even in the Bible, God talked about 10%. So it's always 10. Good. And by 10 years, I was in secondary school. So many things about 10. My first birthday that is celebrated for me was when I was 10 years. So I like 10 a lot. So bring it down. Good. So that's it. Glutes. To work on the glutes, right? Now, there is another interesting exercise for a lot of those people who come in and tell us that they are having issues with squatting. So I want you to come up. Come up now. Good. So bring your legs down a bit. So for people who have issues with squatting, we always want to encourage that they try to attempt their squatting with a chair by the side, right? Then try and go up a bit. Go push, then down. Very good. You start to build from here. Very good. You start to build from here. Very good. So now, it doesn't put so much pressure in your knee. Imagine at against just doing this. Oh my goodness, my knee already hurts. So we don't want that happening. So what we want is where you are building up gradually. And as you keep building up, you know when you are improving, when you are making progress, and how things are working for you. So I feel it's something that you need to look at, pay attention to, and see what improvements you get as time goes on. So, a lot of people have received our treatment exclusively with happiness. So now I'll tell you a little bit a story about a particular client that came, and she was here for treatment of her knee pain. In fact, so far, everybody close to her go to Amazing Physiotherapy. They are experts in what they do. She has not only referred people with knee pain, but also with people with back pain and neck pain. So I'll just read her testimonial. I was introduced to Amazing Physiotherapy by my sister, came in with chronic knee pain after sustaining a fall. I was diagnosed with posterior knee ligament tear by my doctor, and I was told to rest my knee and take pain medication. And if it doesn't improve, I might be needing a surgery. So she came in feeling so bad and wanting to avoid surgery. So her goals aligned with our goals, which was we are in the business of stopping people from taking medications and also in the business of stopping people from doing unnecessary and needless surgery. So now I was limping for the majority of the time. But after getting an appointment to see Dr. Nnamdi and Dr. Joe, one of our amazing therapists, Dr. Joe, who practices in London now, because of the level of expertise he has gathered, clients who leave Amazing Physiotherapy, when they are on holiday in the UK, they go to see Dr. Joe because they know him in Nigeria, they know his work, so they always look for him when they go abroad. So we kind of have an extension. Maybe we'll be thinking of having Amazing Physiotherapy in London, since some of our doctors are already treating patients in London. So you can see her, she's smiling. You can go to our YouTube page, Amazing Physiotherapy, and watch her video. But let me read. So they recommended 12 visits, which I religiously adhered to because I didn't want to continue relying on painkillers or do a surgery. Now I can dance. Now I can say I have my lap back. Now I can dance. I can walk as long as I want, all without a pinch of pain. I highly recommend them to anybody in pain and looking for a better life. Mrs. Bola is her name. So that's really a testimony that touched my heart because I can remember when she came in, she was in tears, not almost in tears. And she was in tears for two reasons. She's not able to play around with her knees, which needed her attention at that time. She wasn't able to, she got angry easily because her body is hurting. So it's normal when we are in pain, we always tend to flare up when little things happen. So frequently asked questions by some of our clients when they want to see us, and they say, do I need a referral from a doctor to see you at Amazing Physiotherapy? I wish to tell them that we are primary care providers. You don't necessarily need a referral to see us in Amazing Physiotherapy. And the reason is our extensive training in the management of musculoskeletal problems has positioned us as practitioners of choice when it comes to handling some of all these problems. We don't want to bother our doctors so much. Our doctors are amazing people so that they can pay attention to handling more complex problems. And I always like to give people this explanation. Which will you prefer? You have a knee pain, and we all know it's a knee pain. At least for you, you know it's a knee pain. You go to see the doctor, you see the first doctor, you order an X-ray, you go for lab tests, and the general doctor says you need to see an orthopedic surgeon. You go to see an orthopedic surgeon after seeing the general doctor and ordering an X-ray. The orthopedic surgeon says, you know what? I'm going to see you, give you more painkillers, advise you on what to do. Okay, your condition is not improving, you do a surgery. But if it's improving, continue taking this pain medication. Now you have gone to see general doctor, X-ray, lab test, orthopedic surgeon. Then orthopedic surgeon will first you to physiotherapist, if he's kind enough. Take that for example. Then another example, you have knee pain and you ring me because you learned of my expertise in the management of knee problems. And you can see that we have given you something of value to educate you more about knee problem. And you now know, and you ring me. Remember, I was still that doctor, that physiotherapist, that the orthopedic surgeon will refer to you after 3 weeks. Seeing the first doctor, doing X-ray, doing everything, and you come to me and I look at it, because of the number of people that I've managed in the past, I say, you know what, this is just a simple quadriceps sprain. Let's get on it and solve it. I've saved you doctor's appointment, saved you painkillers, I've saved you MRI, saved you orthopedic surgeon, and I've saved you heartache. Imagine when you go to the hospital, they say you should prepare for surgery. Then that's too much. A lot of people can't handle that. So do I get knee pain due to old age? That's another interesting question that people ask. It's one of the things we covered when we said a lot of people were saying that they need to ignore it because it's part of aging. I was working with a very top person who was already advanced the seventh decade of his life, a billionaire, and he told me, Dr. Eze, I think I need to live with it because it's part of my life. It's just knee pain and I have it doesn't go. I say, yeah. The problem we also always do is we want to solve those natural changes, those osteoarthritis that is in the joint. We can't do that. It's just like saying, I want to be an old man that doesn't have gray hair. Well, my uncle used to dye his hair, so he didn't like gray hair. But imagine what he did. He was altering it. After 2 weeks, the dye will wash out. We'll see his gray hair. And the funny thing is that he looks better with his gray hair, but he will not agree. He likes yopi. So that's just what happens when you decide to alter your knee pain and say you are old, so you want to alter it. So that's what happens. So at old age, it's not a must, but everybody comes down with arthritis when we begin to age. And when that happens, you have to take care of your posture, you have to be active, because muscle imbalance can compromise the already altered system in the body, right? And when that happens, you may come down with knee pain. So another question is, how can you handle arthritis? It's still the same question. Motion is lotion. The more you move, the less your arthritis becomes painful. If you don't move and you keep altering it and you keep relying on painkillers, the arthritis will never go. What painkillers does is it blocks the pain from reaching your brain. So what it means is you are not feeling the impact of the pain because the painkiller is lying to you. The painkiller is a liar, a good liar for good reasons. And you know we have pain for a reason. We have pain as a signal to tell you that something is going wrong. Imagine something now kills it. So it's just like having a camera in your house to detect when criminals walking into your house. And you now go one day and say, this camera said, you now close them. Close all the cameras. They are not able to view your house and a criminal walks in. Who will you blame? You will blame yourself for blocking the camera and, of course, not detecting the pain or the tips or the arthritis. So do I need surgery? It depends. Surgeries have their role. And usually, I've discussed with my orthopedic surgeon friends and my neurosurgeons. They say they love to leave surgery as the last resort. So what that means is, if surgery is coming in as a last resort, we must have tried conservative treatments for a period of about 12 weeks. That's about 3 months. If you don't improve, then you can have the surgery if surgery becomes necessary. But what we don't prescribe or proscribe to is having surgery off the bat. When you just have the surgery without the detailed examination or even so many things, even the painkillers we are talking about that conservative treatment, but it's all about which conservative treatment is better. So we encourage people to walk more, we encourage people to live a more healthy life, lose weight, do your diet, perform your exercises, see a physical therapist who is specialized in knee. It might save you a lot of heartache, muscle, money, and time wasted. So what exercises can be done for my knee? Just like we demonstrated, the exercises you need to do for your knee must be exercises that focuses on the front of your leg, which is the quadriceps, the back of your legs, and the glutes. We demonstrated some of these exercises. You feel free when you're walking into our clinic to pick copies of these exercises so that you can demonstrate on your own. And we are also going to upload some of the videos online so you can follow us on social media and see some of the exercises that are being demonstrated in this webinar. But just like I said, exercises are too generic when you see them online. You need to be assessed properly, you need to be looked at properly so that the right exercises will be recommended for you. And for people who end up having surgery, even when conservative treatment did not prevent them, you did the right thing. Now, there is what we call pre-rehabilitation. Now, the chances of staying too long in the hospital will be reduced because your muscles are stronger. The chances of a repeat surgery or the surgery failing will be less. The surgeon will be happy because the surgeon's work will be less. It's not going to be going through a lot. And you doing the post-operative rehabilitation after the surgery becomes a lot easier for you too, because you're already used to the exercise and the chances of fall will be reduced. Also very important points to note. So how do I unlock my knees? Sometimes it gets stiff all the time. So unlocking your knee because it gets stiff all the time is part of what happens with knee pain. Just like when we demonstrated earlier, you could see that stiffness is a significant predictor to whether your knee pain is going to recover early or not. If your knee is too stiff, what it means is that the meniscus have probably eroded so badly, because what the meniscus does is, you know, the femur, which is convex in the head, and the tibia, which is a lot concave and flat, the meniscus balances power, it shares power. You know, there is no congruency, so there is no similarity between the head of the femur and the tibia. So the meniscus, which is in between, will balance it up. The meniscus will fit with the tibia and fit with the femur. So when that happens, imagine that thing that is fitting disappears, you are going to struggle because your bone will be hitting on the bone and a lot of pain will be coming out from it. So that is not what we want for you. We want a better and a more active life for you. So if you are still on this webinar, congratulations. You've made it to the last stage and you've made it to a very awesome time of this presentation. Now, we love to give out free assessments and treatment for people who have stayed up till this moment in this webinar. So we know you, we know your name, we are going to take your details, so just feel free walking into any of our office, Lagos, Abuja, and Port Harcourt, and you are going to get 1 week free assessment. 1 week free assessment for you to handle. I'll have to talk to my manager to give this as a gift to people who stay. So even if you don't have any pain, whatever it is you have, you are going to get 1 week free treatment. So when you walk in, we treat you day 1, day 2, day 3. Usually our 1 week package is always 3 sessions. So you can decide to take your 3 treatments in a week or you space it out. You can also invite your friend to use one of the days in the 1 week. So if I'm you, because I'm not greedy, I will bring 3 people. Me, 1, to use 1. I'll bring one of my friends to use another one. I'll bring my mom to use the other one. So now, instead of you getting the 3 days of free treatment, 3 people have gotten free treatment. I think that's fair enough. Am I not nice? I am nice. I think I'm nice. I'm nice. So if you are not sure, you need assessment and want to talk to any of our doctors, you can reach us on 070 26 75 06 37. That is our number. You can reach any of our doctors, have a more detailed conversation about your symptoms and how you want to live your life going forward. You can reach us on 070 26 75 06 37. I repeat, 070 26 75 06 37. So that sorts that out. I know a lot of people will be happy to call, ring us, and have a better explanation for what they want to get as regards whatever pain it is that they are helping. So it is not only knee pain we have back pain, neck pain, knee pain, shoulder pain, ankle pain, foot pain. So many musculoskeletal problems are within what we do. If we can't help you, we will refer you to a specialist. That is our work. What makes a specialist is if he cannot manage your problem and he feels it's beyond his scope of practice, he will easily refer you to the doctor or the specialist of choice that can solve your problem. And that is what we always pride ourselves in Amazing Physiotherapy as. So you can reach us on www.amazingphysioclinic.com. You can send us a message on info@amazingphysioclinic.com or amazingphysiotherapyclinic@gmail.com. Feel free, send us your questions. If you like this presentation, tell us what you want to be hearing. Tell us the next presentation you would like us to talk about. And of course, most likely, it is our patient's presentation and our patient choices and preferences that we will always uphold. Our patients are our priority, and we'll always make sure that they always laugh first. So thank you very much for listening to my presentation. We've come to the end of the presentation for knee pain, and tune in with us next month, same Friday, last Friday of next month in October. We are going to be talking about another presentation. Next month, we are going to be talking about dizziness. So feel free, join us next month, ending where we will discuss vertigo and dizziness, right? It's pretty much a very common problem that a lot of people do not have solutions for. But we are going to break down dizziness and vertigo so that people who have these symptoms do know how to solve their problem. And it's not very interesting for you to know that dizziness and vertigo all happen differently. There is BPPV, there is normal vertigo that is a result of an infection, there is vertigo that is coming as a result of neck pain. So many things can lead to vertigo. So on that day, we are going to break it down and let you know what is causing what. Thank you very much. We'll be waiting for your questions, and as they come, we will reply. Okay.
Okay, our first. Okay, so our first question here says, what about injections given to the knee joint? Are they a good idea?
Okay, so if I get you correctly, We are talking about injections given to a knee joint. Now, researchers have come up to say injections to knee joints do more harm than good. When, especially the corticosteroid injections that is usually very popular. First of all, we have known corticosteroid injections as injections that will be given not more than 2 or 3 times in a year because of osteoporosis. But beyond that, it erodes the joint surfaces. It erodes the capsular articular joint surfaces. It erodes the joint capsule. It erodes the meniscus, and that is really very bad for you. So it gets you into a more terrible situation faster. But the good thing is that it will relieve your pain. But has that solved your problem? Not likely. So solving your problem is different from relieving you of pain. Relieving you of pain is just like what a painkiller does. So imagine getting an injection that along the line will cause and compromise the integrity of your joints. Why take it? So corticosteroids are gradually being phased out as interventions that shouldn't be what we will rush to, but they also fall in as conservative treatments. And when I mean by conservative treatment, these are treatments without the invasive procedures, which the surgery and other arthroscopic procedures fall into. But usually, by and large, we love to encourage people explore the options for your conservative treatment first before you talk about surgery. Okay, so.
Okay, the next question here is, what causes constant clicking sound relief? What causes constant clicking sound relief to trauma? No overriding of joint, but knee keeps clicking often. Yes,
so clicking, there is something we refer to as crepitus in the knee, and it's pretty very popular for a lot of people who have issues. Old age, in fact, is one of the things we assess. So you begin to get that clicking sound in the knee. And just like I said, you know, that sound is coming from the meniscus. Look at how it works. The medial meniscus, right, which falls in, it has its own shape that supports the upper part and the lower part. Now, when it begins to erode because of trauma or injury, it's no longer giving that smooth ride on that convex or the flat, more concave surface of the tibia, right? So now, it's not as smooth. No matter how much the synovial fluid lubricates the area, you'll be hearing that click sound because it's just like Nigerian road. To be like Nigerian road that has gallop, to be gallop, gallop, gallop inside. So that's what usually happens. You'll be hearing that click sound here and there. So next question.
So the next question is, I have an X-ray film done for my right knee, as I usually feel excruciating pain. Can I come with it? And can we get a discount, as the price told me when I called was scary? Thank you.
Okay, so now this webinar that you attended has given you 3 free visits. I used to tell people that it is not about the X-ray that was taken several months back, but it's about how is it affecting you. When you come with your X-ray, it will serve as a guide. We'll keep it aside. Then we'll look at you as a human being. Once we look at you, we assess you, then we know where we will place more priority than the other. We'll break it down, make our recommendations, and surely you will get the right solution to your problem. Now, as regards discount, we are currently running a 50% off for the sessions in our clinic, but for members that attended and stayed to the end of this webinar, they are getting 3 free visits, which they can either come and do themselves for 3 visits or give to 3 people in their clinics.
And the person that asked for that same teaching sound, the individual with the knee clicking sound is not up to 30 years, not old, no trauma, no overuse of knee joints. So she still sent another question.
Yes. So now, there is something I also want us to note. This question you ask even brings my mind back to, in the past, we used to say arthritic changes happens with old people. But there are lots of interesting researches that have come out to even say degenerative changes even start from 23. Most of the time, when the joints have fused, degenerative changes begin to start. Now, if the person is having clicking sound without trauma and at that age, there may be other causes for that. Just like I said, knee pain is not just all about osteoarthritis. There are over 12 different knee conditions that we have treated. Osgood-Schlatter disease, pes Hansarian bursitis, knee sprain, ligaments, rupture. And again, remember, when, just like I said, meniscus, capsule, synovial membrane, all of them, and the muscle, all of them work to create that stability for the knee. If anything happens to any, you hear that click sound. For example, the athlete that we are working on who sustained an ACL tear, he had a surgical repair. But in the ACL, there are two bands, right? The anterior medial band and the posterior lateral band. The bands are supposed to crisscross each other. When certain movements happen, one is locked, one is lax. Now the posterior one was lax. So we are not getting that stability it needs when it's in extension. Clicking sound continues to happen. So clicking sound is as a result of a structural problem. So it will be important to sit down with the person, look at the knee, and know what has happened. It can also be a hormonal issue if the person is a woman. That also happens. You've got to see hormonal problems that have affected the joint. I know a lady who dislocates frequently whenever she's pregnant and when she has had a baby. And when she stopped having kids, dislocation disappeared from her life.
Okay, so we have a question from Instagram, and this is from Dan, and he says, can opening grab 3 and 4 and 5 and 6 vertebrae on a backbone over 8 years old be fixed?
Yes. So now I can understand that you're talking about the spine, the backbone spine, and the 3 and 4 means the cervical, that's the neck. So this person is probably coming down with neck pain, right? And if the pain is the pain radiating to any of your arms, if it's not radiating, then you shouldn't worry. Openings, closing, extrusion, degeneration, all are reports you get from MRIs. I always used to advise people that the best thing is to sit down with a specialist that understands your problem and he's able to give you details of how to solve this problem. Once you're able to do that, voila, the problem is solved. So I don't know the significance or the level at which the openings are happening, but I'm very sure that it is a problem that can be fixed. There's usually nothing that cannot be fixed by the grace of God.
Okay, so earlier on, the same person said, please, where is your clinic situated? We'd like to come in to fix 2 sleepies. Okay,
beautiful. So our clinics are in Lagos, Abuja, and Port Harcourt. In Abuja, we have in Wuse 2, Garki 2, Jabi, Gwarimpa. In Lagos, we have in the mainland and in the island. In Port Harcourt, we have in D-Line, I think around New GRA, Old GRA. Then we also have our inpatients in Garki and in Gwarimpa, in Wuse 2 and in Gwarimpa. Our inpatient is for people who are traveling from a far distance and would want to stay in this facility to get a much more intensive program. So our inpatient rehabilitation is available, is open. But most of the time, it sees more of people who have spinal cord injury, traumatic brain injury, or even post-surgical rehabilitation cases. Those are the people that use our inpatient rehabilitation.
Okay, the same person is saying that it's at the base of his backbone, not neck.
Okay, so if it's at the base of the backbone, then it's not C3, C2. It's likely going to be L. So if it's the L or lumbar region, it is something that can be fixed. Slip disc is what we see all the time in our clinic. I can remember that young man that came into our clinic, and because I don't know, that there was one man in Usage that he came in, he was like crawling into the clinic. Yes. But he was able to, I think he wrote us a very long testimonial thanking us for what we did. So slip disc is what we see all the time. We have specialists, doctors of physiotherapy who manage low back pain and slip disc disorders.
Okay, so we have a lot of questions. So then let's start. Okay, what do you do in case of a fracture on the hip? This happened to an elderly woman of 84 years.
So in case of a fracture of the hip, yes. So the fracture of the hip is also an interesting topic. Hip problems, especially with elderly. And as I answer this question, it's a little bit emotional for me because I lost my grandmother from hip fracture. And now this is what happens with hip fracture. Just for education before I answer the question. Now with hip fracture, why we don't want elderly people to fall and have issues with their hip is when they fall, the fracture can traumatize the vein that runs across the hip. And that can lead to internal bleeding and the person may die. So that exactly was what happened to my grandmother. And now I am a physical therapist. I dedicate my work, everything I do, in memory of my grandmother, and we don't joke with people that have knee hip problems. So if there is a fracture in your hip, we need to determine the kind of fracture the person sustained. Then there will be a need for a reduction. Open reduction, internal fixations. If it's around the joints, then there may be a need for hip replacements. Hip replacements are pretty much very common interventions too, and they really work well. So if that is your case, I think it would be good for you to come on board so that we can determine or even have a much more detailed understanding of what the cause of your hip pain is.
Okay, this is what causes stiffness in the knee joint? Why does the stiffness occur mostly in the morning?
Yes, this is a very interesting and intelligent question. Yes. Good. So now, stiffness occurs so much in the morning because it's also part of the question we ask people when they come into the clinic. Do you have early morning stiffness? This is the reason why stiffness occurs in the morning. When we are moving, just like I said, motion is motion. There is more lubrication within our joints. And lubrication is a result of the fluid that is also made up of water. That is why when you wake up in the morning, right, because the fluid is not expanding as much, right, it shrinks more when we are not moving. It also happens in the back. It shrinks more. So when you are not moving, the fluid shrinks. And when it shrinks, it's not going to be providing the necessary lubrication within the joint. And that will cause that stiffness in the morning. That is why when you start moving again, the lubrication comes back. Lubrication in the system, of course, is made up of water and so many other, complex materials. that God has put in to make our life better. So when that happens, lubrication comes back. So, but when you sleep, when you sit down in one place for too long, the lubrication within the joint goes down.
Okay. And the next question is, why is pain more in descending the stairs for people with knee osteoarthritis?
Very good. Very interesting question. We have very intelligent people here. Now, you people sound like doctors already. God bless you. If you are descending the stairs, this is what happens. When you have osteoarthritis in the knee, yes, osteoarthritis is a general description of the knee pain. But in descending the knee, right, the recruitment of the muscle is responsible for that. When you are descending the knee, you are likely having extension, right? So if you are extending your knee, it is likely that there is more translation, there is more forward movement. When you look at the femur, when you are extending, right? You are extending, the femur is pushing back, the tibia is moving forward. So most likely with the meniscus, especially the medial meniscus, when it pushes forward, you will feel a lot more pain with doing that. And it all has to do with the osteo, that's the bone movement within the knee. Extension pushes the femur forward, the tibia forward. And when tibia moves anteriorly for you to stretch, if there is a problem within the meniscus in your osteoarthritis, you are going to be experiencing so much pain.
Okay, so well, we have a recommendation here. Someone is saying, this is from Nnamdi. He's saying, well done for Nnamdi and the amazing physio in general. You guys are amazing indeed. CQ. All right. So another question here. Okay, this one says, I am the lady that posted about a fracture. So do you carry out surgery in your clinic?
No, we don't carry surgery. We don't do surgery.
When you say hip replacement, I believe you're talking about surgery.
Yes.
Okay. If we are not considering surgery, what are my other options? Won't traditional way work?
Yes. So, with great sense of humility and respect for the traditional bone setters, those folks are equally amazing in their work. And over time, they have even evolved to be more results, outcome-based oriented, more patient-centered in their approach. Fractures are not what we handle in our clinic, but we want to make the outcome of your fracture better so that you can live a more functional and productive life. The best thing will just be go to a nearby hospital, ask for an orthopedic surgeon to review the fracture. Once he reviews the fracture, he will make a recommendation for what he wants to do. So this is not where we will be talking about who and who knows the work, whether a traditional bone setter does not know it or not. But my own advice, within my own orthodox kind of approach, will just be to go to the hospital, request to see an orthopedic surgeon who will review the case and make his recommendations. So,
all right, so she said many things.
Okay, thank you. So we have to move on. So drop the address.
Yes, he asked the question. He said, can this L3 and 4, can this L3 and 4 and L5 and 6 affect man interest and function in the other
Very possible. If you have back pain, you'll be thinking more of your pain than the other room. That's natural. Okay, so that's it. So I want to thank everybody that stayed up to this very moment. I can see people all around the world. I can see people from the UK, from the US, from China. Oh, I see my friend Lin Kuan Yu. Thank you very much for staying for our webinar. I really, really appreciate this. So see you next month.
So we have someone that sent the message through the mail, through our newsletter. So I'm trying to see. Okay. So Elijah Nile. Good day, sir. Thank you so much for your. Okay, thank you for the newsletter. Please, I've done knee surgery and I'm still experiencing pain in the leg. To move and or walk is a problem. Okay, to move and to walk is a problem to me. Please, is there anything that can be done to help alleviate the pain? Expecting your reply as early as possible.
Yes, so just like what we talked about when we made mention of interregional, complex regional interdependence around the joints. We've had instances where surgeries were done for the knee when they should have been done somewhere else. When that happens, it is likely that where was the primary cause of your pain will continue to hurt. It's just like with back pain. When people have piriformis syndrome and they go get a back surgery, their back pain will continue to be there because the primary cause of the pain wasn't taken care of. I don't know what led to your surgery because your question wasn't detailed. But what I will say is, I think there will be an opportunity for you to visit any of our clinics, sit down with any of our doctors, and have a proper examination done. If you've done a surgery and you still have knee pain, I think we will look at another most likely reason why your pain has persisted. And once we're able to do that, we'll make our recommendations for you, and I'm sure you will get the relief that you are looking for. So, in the absence of any other question, I want to thank everybody that stayed up to this moment to listen to our webinar. I want to thank the production crew, the camera people who made it possible. And I want to also appreciate Azim Health Software. They are the sponsors of today's program, an amazing inpatient and rehabilitation who made this program possible today. You feel free to visit our website, www.amazingphysioclinic.com. Pick any of our locations, ask any of your questions, and you will get your response. Thank you so much for your time. We appreciate your patience. God bless you.
Oh.